The pulmonary veins can drain abnormally in the right atrium, in the cava, in the portal vein. There can be partial or complete anomalous pulmonary venous return. 23 plus variants of abnormal course and abnormal drainage have been described. In some infants, like in this baby who is born with cyanosis and shortness of breath, the lungs are very edematous. The differential diagnosis would include hypoplastic left heart syndrome, congenital pulmonary lymphangiectasis, and anomalous pulmonary venous return below the diaphragm with obstruction of the draining vein. In the venous phase of a pulmonary angiographic examination, we see a common vein that traverses the diaphragm and drains medially. So this is a total anomalous pulmonary vein. In the lateral view, we can see that this vein drains into the portal system and relative obstruction of the drainage of this common vein was the cause of the pulmonary edema. Here is a specimen that shows the common pulmonary vein draining below the diaphragm and connecting with the portal vein. This patient had abnormal drainage of the two lungs into a common pulmonary vein, which was atretic, and therefore the patient is born with massive pulmonary edema. Here we have anomalous pulmonary venous connection where the vein drains into the superior vena cava. In this patient, we see faintly the figure of 8 of Albers, which represents a total anomalous pulmonary venous return above the diaphragm. The prominent right atrium is because it receives systemic veins as well as the pulmonary venous return. The upper part of the mediastinum is widened due to an enlarged superior vena cava and also an enlarged left vertical vein. The lungs are not very hypervascular. Here we can see that some of the pulmonary veins drain normally into the left atrium. However, we note a large left vertical vein that connects with the innominate vein, and from there it drains into the superior vena cava. This arch constitutes the superior portion of the figure of 8 of. In this angiogram, one can see the opacification of the left vertical vein and of a dilated innominate vein as well as the superior vena. This is finally a case where there is an infradiaphragmatic venous drainage of a patient with total anomalous venous return. The contrast fills the right atrium, so therefore a right to left shunt is produced.